In early 2020, a replacement virus began generating headlines everywhere the planet due to the unprecedented speed of its transmission. From its origins during a foodstuff in Wuhan, China, in December 2019 to countries as far-flung as the United States and also the Philippines, the virus, officially named SARS-CoV-2, has affected tens of thousands, with a rising price now over 4,000. The disease caused by an infection with SARS-CoV-2 is named COVID-19, which stands for Coronavirus Disease 19. In spite of the worldwide panic within the news about this virus, you're unlikely to contract SARS-CoV-2 unless you've been in touch with someone who's confirmed to possess the virus. What are the symptoms? Doctors are learning new things about this virus a day. So far, we all know that COVID-19 might not initially cause any symptoms. You may carry the virus for 2 days or up to 2 weeks. Trusted source before you notice symptoms. Some common symptoms that are specifically linked to COVID-19 include shortness of breath, having a cough that gets more severe over time, a low-grade fever that gently increases in temperature. The full list of symptoms remains being investigated. What to try and do if you've got symptoms of COVID-19. If you've got COVID-19 or suspect you've got the virus that causes COVID-19, you ought to seek medical aid. COVID-19 versus the flu. The 2019 coronavirus is far more deadly than the seasonal flu. An estimated 0.06 to 0.1% trusted source of individuals who developed the flu during the 2019-2020 flu season within us died as of February 2020, compared to around 3% trusted source of these with a confirmed case of COVID-19 within us. Here are some common symptoms of the flu. Cough, runny or stuffy nose, sneezing, sore throat, fever, headache, fatigue, chills, body aches. What causes coronaviruses? Coronaviruses are zoonotic. This suggests they first develop in animals before developing in humans. For the virus to pass from animal to humans, an individual has got to inherit close contact with an animal that carries the infection. Once the virus develops in people, coronaviruses are often spread from person to person through respiratory droplets. This is often a technical name for the wet stuff that moves through the air once you cough or sneeze. The viral material hangs cool at these droplets and may be breathed into the tract, ear, windpipe and lungs, where the virus can then cause an infection. The 2019 coronavirus hasn't been definitively linked to a selected animal. Researchers believe that the virus may have passed from bats to a different animal, either snakes or pangolins, then transmitted to humans. This transmission likely occurred within the open foodstuff in Wuhan, China. Who's at increased risk? You're at high risk for contracting SARS-CoV-2 if you inherit contact with someone who's carrying it, especially if you've been exposed to their saliva or been near them when they've coughed or sneezed. Hand washing is key. Washing your hands and disinfecting surfaces can help decrease your risk for catching this and other viruses. Older men seem to be especially vulnerable to the virus. A late January report by the Planet Health Organization (WHO) trusted source found that the median age of individuals testing positive for this coronavirus was around 45 years, which over 2/3 of these people were male. How are coronaviruses diagnosed? COVID-19 are often diagnosed similarly to other conditions caused by viral infections, employing a blood, saliva, or tissue sample. Talk to your doctor directly if you think that you've got COVID-19, otherwise you notice symptoms. Your doctor will speak to local public health officials to supply guidance on whether testing for the virus is required. A lab technician will either draw a sample of your blood with a needle or use a cotton swab to require little sample of saliva or respiratory secretions from your nose or the rear of your throat. The sample is then sent to a testing facility to verify the presence of viral material or antibodies that answer the virus. What treatments are available? There's currently no treatment specifically approved for COVID-19, and no cure for an infection, although treatments and vaccines are currently under study. Instead, treatment focuses on managing symptoms because the virus runs its course. Seek immediate medical help if you think that you've got COVID-19. Your doctor will recommend treatment for any symptoms or complications that develop. Other coronaviruses like SARS and MERS do have vaccines and coverings. Some treatments for these similar viruses include antiviral or retroviral medications, breathing support like mechanical ventilation, steroids to scale back lung swelling, blood plasma transfusions. What are the possible complications from COVID-19? The most serious complication of a SARS-CoV-2 infection may be a sort of pneumonia that's been called 2019 novel coronavirus-infected pneumonia (NCIP). Results from a 2020 study trusted source of 138 people admitted into hospitals in Wuhan, China, with NCIP found that 26% of these admitted had severe cases and needed to be treated within the medical care unit (ICU). About 4.3% of those people that were admitted to the ICU died from this sort of pneumonia. So far, NCIP is the only complication specifically linked to the 2019 coronavirus. Researchers have seen the subsequent complications in people that have developed COVID-19. Acute respiratory distress syndrome (ARDS), irregular pulse (arrhythmia), cardiovascular shock, severe muscle pain (myalgia), fatigue, heart damage or attack. How to prevent coronaviruses? The best thanks to prevent the spread of infection is to avoid or limit contact with people that are showing symptoms of COVID-19 or any respiratory tract infection. The next neatest thing you'll do is practice good hygiene to stop bacteria and viruses from spreading. Prevention tips: wash your hands frequently for a minimum of 20 seconds at a time with warm water and soap. How long is 20 seconds? About as long because it takes to sing your ABCs. Don't touch your face, eyes, nose, or mouth when your hands are dirty. Don't leave if you're feeling sick or have any cold or flu symptoms. Stay at least 3 feet trusted source far away from anyone who is coughing or sneezing. Cover your mouth with the within of your elbow whenever you sneeze or cough. Throw away any tissues you employ directly. Clean any objects you touch tons. Use disinfectants on objects like phones, computers, utensils, dishware, and doorknobs. Other sorts of coronaviruses. A coronavirus gets its name from the way it's under a microscope. The word corona means crown, and when examined closely, the round virus features a crown of proteins called peplomers jutting out from its center in every direction. These proteins help the virus identify whether it can infect its host. The condition referred to as severe acute respiratory syndrome (SARS) was also linked to a highly infectious coronavirus back within the early 2000s. The SARS virus has since been contained and therefore the condition found to be successfully treatable. Did you like the video? Subscribe to our channel.